I'm going to let you pronounce your name for me.
Okay, Santosh Menon
And you are with?
with the Ohio Heart and Vascular Center in Cincinnati, Ohio.
And what's the tie-in with this fabulous rowing competition?
We wanted to look at the hearts of elite rowers at high school level. And this was the best opportunity. This is where they gather, once a year, the top rowers come here. And so we've been working with U.S. Rowing, Toshiba, to Cincinnati Children's Hospital, University of Mississippi. We got this together. So there's 2 docs here with myself and another doc. And we had 3 echo techs and 2 machines with EKGs. So it's a unique population. Nobody's ever studied these kids before. We're trying to define what is the athlete's heart. There's a lot of confusion as to who has an athlete's heart versus who has a real bad heart. And so we're trying to do that and to look at unique changes in rowers, because it's a unique activity and nobody's ever looked at high school rowers. And we looked at our 10 previously. We found changes that were pretty unique to them in a very short time, within 2 years of rowing. So we think that changes occur early rather than when they become adults.
And when you speak of changes, are these good, bad?
We think they're okay. We think they're okay, and that's what we're trying to define, that what is the difference between bad and good. And I think the more data we get, the better it is, and the more information we have that we can disseminate to other cardiologists, pediatric cardiologists, even general internists, say this is normal versus abnormal. And also the same thing with the EKG. These EKGs tend to be different in kids. And you got to know what is pathological versus normal. And I think, and this is a very unique population. They're all the same size. They all do the same exercise. And so there's not big weight differences, size differences in terms of the heart size and things like that. So it's a very nice population.
And how do you foresee this helping people in the future?
I think it'll bring, as physicians, healthcare professionals will be more aware of what is the athlete's heart versus a really bad heart, what we call something like hypertrophic cardiomyopathy, which is very deadly. This helps define that. This will add to our database. And also, what is the changes over time? We have another part of the study where we look at novice rowers and then do them at year 3 of rowing and see what changes we see in them over time.
And now an EKG is not a normal part of, say, a physical for a youth.
Exactly. In fact, all you need is a physician's history and physical. That's all you need. EKGs are controversial, as are echocardiograms. Like, for instance, Italy does EKGs and echoes on every one of their athletes, every one. It's cost prohibitive, time prohibitive, and I think there's a lot of what we call false positive, where actually it's normal, but what we find is that there was an abnormality seen. So again, we're trying to move the science ahead in that we'll know more about what is normal. And we're also using a very quick ramped up protocol where the echo is done within 7 minutes. So it's much quicker, and hopefully it'll be much cheaper in the future too.
So it sounds like you want to make some technology like this more accessible.
Absolutely, absolutely. I think parents are concerned. Sudden cardiac death is nothing to be taken lightly, especially in rowers where they are not within an arena where they can reach help very quickly. They're out in the water. So, I think understanding the rower's heart, I think, will help a lot of people, especially as rowing becomes more popular. I think understanding what the changes are, what is normal versus abnormal, I think is very important.
Now I'm going to ask another common sense tip for parents maybe this year, who might be engaging in any sorts of athletics and in having those sports physicals. Are there questions they should be asking their own physicians? Are there certain lines of inquiry that they should be more kind of aware of to help their child now?
I think there are a couple of things. When you do the questionnaire at the doctor's office, the pre-physical questionnaire, make sure that you be honest about what's going on with your child. Be honest, or be forthright and go into detail about family history of heart disease. And bring that, and medications the child is taking, bring that to the attention of the physician. And ask, is my child at risk if they exercise? And always get a history and physical examination by your physician before you start a physical activity for your child.
And should they ask for an extra look at the heart if there are concerns?
If you're concerned enough, if you have a family history of heart disease, especially sudden death, if you have a heart murmur, or had heart problems as a parent, or your parents had it, or if your child is on medications that may affect the heart in terms of the EKG, ask for an EKG.
Are there any environmental factors involved with this?
Not really. Again, environmental factors. I mean, if you're obviously if you have all the risk factors such as morbid obesity, diabetes at a young age, you're high risk for blockages in the heart. And those do happen in early ages and teenagers. And those kids should be checked out extra carefully before you undertake a rigorous physical activity.
Is there anything I left out that we would want to add regarding this subject?
Be aware. I mean, if you think your child is at risk or has had some symptoms, such as passing out when they exercise heavily, or heart racing out of control, or a family history of heart disease, get your kid checked out. Very important.